Hi students, today we will be discussing on post-insertion instructions in complete dentures. So basically we will be discussing about what are the instructions that you're going to give to your patient after your complete denture is inserted or you're delivering the denture to the patient. So in this we'll be talking about small introduction, denture insertion and removal, what to expect from the dentures. All this you'll be explaining to the patient obviously. How to use a denture, how to care for your dentures, about your recall and maintenance protocols, and a conclusion. Coming to the introduction, instructions are more important for patients who are having dentures, especially for the first time. For first time first time denture wearers, getting accustomed to a new denture is going to be a very tedious procedure. The most important thing that we tell the patients is that if we have spent 15 days in making the denture for you, the next 15 days you are going to train yourself and convince yourself that you're going to be using a new denture. That is the first instruction that most prosthodontists are going to give to your patient. Why? Because a denture wearing is not just about a good denture delivered to the patient. If the patient does not know how to use this denture properly, then a good denture will not work. Now, what are instructions that is mainly contain? First is how to wear the denture and how to remove the denture. That is denture insertion and removal. Then, what all do you expect from the denture? Do not give unrealistic expectations from the denture. Oh, you place the denture, you're going to be like this, you're going to be like that. No, tell them very frankly that these things are what you're going to expect. You can expect pain, you can expect difficulty in speech, you can expect difficulty in wearing and removing, you can expect looseness of the dentures, you can expect that your denture might move every time you talk or move your tongue. So this has to be told to the patient. Be as realistic as possible to your patient. How to use your denture? How to use does not only mean wearing, inserting or removal. How to use also means how to clean it, how to maintain it, and how to wear it properly, when to remove it, and when all to clean it. Care for your dentures, about cleaning dentures, cleansing, storage of the dentures, and tell them why you need it to be clean. First, coming to denture insertion and removal. Take a mirror, give it in the patient's hand, or take a patient to a mirror and show them how you remove it and you place it. Okay. The patient is taught to insert and remove the denture. It is preferable to wear the upper denture first, followed by the lower denture, as the upper is more retentive. It is preferable to remove the lower denture first, then followed by the upper denture. When your patient is wearing a denture for the first time, they will be very apprehensive about the fact that, oh, the lower denture is not as tight as the upper denture. So tell them to first wear the upper denture, because once you place the upper, it is quite retentive. Then you place the lower, it's not going to fall. So the patient is confident when the upper is placed properly. Show them how you're placing it and ask them how to place it by themselves by showing the mirror. When you're removing, before you teach them how to remove the upper, tell them that the lower is very easily removable. Just lift it with your tongue, it will come out, right? So you teach them removal of the lower first and then the removal of the upper. What to expect from dentures? You have to give a reality check to all your patients about what they should be expecting will happen when they place your dentures in the next maybe 24 to 72 hours. They should be first of all instructed that this is an artificial substitute. It is not going to work like your natural teeth. It has its own set of limitations. So what are the normal reactions, what all you will get once you place a new denture? First thing, we'll be having an awkward feeling in the beginning. Appearance seem to be changed. You have been edentulous for like past 1.5 months. Ideally, after your complete extraction, you wait for 2 months and then give your denture. So that could take around 15 days. So maybe for the past 2.5 months, you have been without a denture in the mouth. You have been completely edentulous. Your lips have not been supported. So when you place your denture, you will feel a sudden difference in change, a change in the appearance especially. That is, you will feel a fullness, you will feel like something is there inside the mouth. So it will feel difficult. Speech is altered because your tongue, which has been quite freely roaming around for the past few months, is suddenly guarded in between your lower denture. Feeling of a mouth fullness, excessive salivary flow. A very simple example that I usually tell to all the patients is that if you have a dust which is blown into your eyes will start watering up, right? That is the exact same reaction what happens when you keep a denture inside a patient's mouth. For the mouth or for the body, this denture is a foreign body which comes at that point of time. The first thing that your body tries to do is to reject it by two methods. First, excessive saliva, because of which the denture will not stay there and it's trying to be pushed out. Second is the tongue trying to push it out. So these two things is definitely going to happen. Lower denture may be dislodged during speech and eating. Most patients have a tendency to actually try to push the denture out knowingly with the tongue. It is not that they're not doing it on purpose, but it's just that the tongue involuntarily it's trying to push it out because the tongue, which has been freely roaming around, is now feeling very restricted with the lower denture there. So during speech and during eating, the tongue is somehow trying to push it off and clear off the path so that it is freely be seated there. The tongue position, especially when using the dentures, your tongue position is very important. The tongue has to actually rest in a place, especially in the lingual flanges of the lower denture. That will enhance the stability of the denture. Tongue position needs to be trained for various purposes. First is to stabilize the denture. Second is to correct your speech. Okay, for these two major reasons, your tongue needs to be trained. Patient must practice mouth opening and closing with the tongue in the forward position, resting against the inside of the denture flange and the lower front teeth. The same position should be maintained while opening mouth to receive food. If the maxillary denture feels loosened, the patient must be advised to close the mouth and swallow, which will elevate the tongue and reseat the denture. While eating, what is the instructions? The patient should be advised that eating efficiency requires training and patience and usually requires around 6 to 8 weeks to chew comfortably. That's again like around 2 months. So you cannot expect or the patient cannot expect that today I place a denture and the next day I'm going to eat the hardest substance available to eat. No, there is a protocol on how you shift. For the first 2 weeks, you advise your patient to go on soft diet. The next 2 weeks after that, they shift to medium soft diet. And then slowly, after 2 weeks, after 4 weeks, after the denture delivery, slowly start eating hard food. Now, hard in the sense, hard in its limitations. You are not expecting to bite something like cracking a nut or something like that. That is not what you're planning to do. Avoid having advise a patient to avoid eating anything that is sticky. Okay, something like a halwa or a chewing gum because it's a removable denture. Something sticky will pull out the denture along with the food. Make sure the patient trains himself to chew on both the sides at the same time. Take a bolus, split it equally to both the sides and chew simultaneously with both sides. Only this can help them chew properly and only this can help the denture be stable and more retentive also. It is a very simple thing. You're placing the denture is on the denture tooth are on a single base. So if the patient bites on this side alone, this side it will dislodge. Vice versa. The following methods are adopted initially. The food should be cut into small pieces, placed on the back teeth, chewed slowly using both sides simultaneously. That is very, very important. Both sides simultaneously. Some people will say, Yes, doctor, I chewed on both sides. They are chewing first on this side, then on the other side. They are using both sides. That is correct. But the factor that it has to be used simultaneously at the same time is the most important aspect of it. They should begin with soft, non-sticky food rather than fibrous food. Biting with front teeth should be avoided till the chewing with the posterior teeth is mastered. Now, mostly pressure or by chewing forces on the anterior tooth is avoided always. Next is speech. Patients can expect speech problems initially due to the presence of a palatal plate, initial feeling of bulk and excessive salivation. The patient should be encouraged to read loudly and then repeat the words that give them trouble. So ask them to take a paper or a magazine. Sit alone in a room, not in public. Sit alone in a room and read loudly. Now, the reason for this is when they read loudly, they are able to hear which all words need to be corrected. So, next time they read, they will give extra focus on those words. This is common for every patient. Next is sneezing and coughing. Patients should be instructed that extreme and sudden movements of sneezing and coughing can actually dislodge your dentures and cause embarrassment. It is very common and we cannot avoid anything because of that. So what we usually tell them is either you carry a handkerchief so that you cover your mouth when you're sneezing or coughing so that even if it jumps out, it jumps into the handkerchief. Tissue rest, very, very important. The name that it is a removable prosthesis. A complete denture is a removable prosthesis. It is removable because it needs to be removable, not because it can be removed, but more importantly that it needs to be or it should be removed completely. Okay. They should be advised to remove the dentures at night to provide rest to the tissues from the stresses during the day. Failure to do this can actually cause soreness, tissue irritation, increased chances for candidiasis and bruxism. In a case of pain, the patient should not be encouraged to wear the dentures and should definitely come back to the dentist. If a patient has a sore or a painful area, just by removing the denture will not do the trick because they will remove the denture, the sore will heal, they will again wear the denture and this is repeated. Rather, they should discontinue along with correction in the overextension in the denture area. This is how a denture brush will look like. This area is used for cleaning on the tooth surface and this area, if you see, is for cleaning on the palatal surface and the lingual side. Caring for dentures. Dental plaque is a cause for denture stomatitis, candidiasis, inflammatory papillary hyperplasia, bad odor and bone loss. It must be removed. Patient must be instructed to rinse their mouth and dentures after every meal if possible. So once you finish eating, ask the patient to remove it, slightly run under water and keep it back. At night, the dentures should be brushed gently using a soft denture brush to remove the plaque. We do not recommend too much of use for toothpaste. Rather, a normal soap water will do the trick because toothpaste can actually be abrasive and it can abrade the denture tooth. Now, another thing that is available is a denture cleansing tablet. Okay, uh, you have denture cleansing tablets which are available. You can take a container of water, put the denture cleansing tablet into it, wait for the effervescence. Now you even have color changing tablets. So wait for the color change, dip the denture in it for a certain period of time as instructed by the manufacturer. Then take it out, rinse it and put it in the water overnight. Now, while brushing, the dentures should be held over a container of water so that the water cushions the impact if it slips out of the hand or what. If the patient is washing the denture in a wash basin, ask them to keep a container of water, open the tap and clean it over that so that even if it falls, see, one thing we have to remember is that most of the denture wearing patients will be of an older age. So, If it slips out of their hand, they are not to be blamed. So rather, we give them the instruction to avoid that. So even if it falls, it's going to fall into that water. So the denture will not be fractured. Now, again, like I said, denture cleansing agents are available. Example, you have something called as Densive, which is available. Densive, again, is color changing denture cleansing tablet, which is available. So, advise the patient to remove the dentures and place them in a container with a lid with water. The water should not be hot because hot water can actually distort the denture. A simple denture cleanser can be made with the following: sodium hypochlorite, which can provide bleaching and germicidal action; water softener like Calgon softens and loosens food deposits; and normal water. Sonic cleanser can also be used for cleansing. Now, again in the morning, the denture should be brushed and then worn. The surface of the residual ridges should also be brushed gently or massaged with a warm cloth. This will increase the circulation and help in removing plaque. It greatly reduces tissue inflammation. To remove calculus, dentures should be soaked overnight in white vinegar, which contains acetic acid to decalcify calculus deposits. Now, occasional soaking in the solution can prevent calculus formation. How about recall and maintenance? Now, recall appointments should be scheduled mostly. The first recall should be within 1 to 3 days for sure. Preferably, we do it in the first 24 hours. Why? Because before 24 hours, you can actually see the sore spots if there are any, but the patient will not start having pain. After 24 hours is when it starts bruising and patient exhibits pain. So you can do the first recall visit at 24 hours before pain starts, but you can see the sore spots. Second recall should be 1 week after the first visit. Third recall around 3 to 4 months after the second visit. Maintenance should be once every year. Now, this is a general recall program which may need modification depending on the patient and the denture. Okay, if the patient has repeated issues, problems, or occlusal adjustments to be done, you recall according to that convenience. The denture insertion appointment is very important in delivering a functional and an aesthetic denture to the patient. The most important is the need for the patient to understand that the denture comes with its own set of limitations. It is also helpful that you actually have all your post-insertion instructions typed out in a piece of paper in English or maybe in your local language, and give it to the patient along with the denture and the denture box and accessories that you're giving to the patient. Why? Because, like I said, most patients are old. So there is a tendency that they actually keep forgetting things. Always make sure the instructions are given to the patient, also their bystander who comes or who's there to take care of them. Because in case they forget to remove the denture, they should have somebody to tell them that please remove your dentures. Using the denture continuously overnight can actually lead to candidal infections, and which can cause serious health issues, especially with diabetic patients. Okay, so all these should be explained in detail. Do not think that you have done the denture insertion and that's it. The denture, it is complete. No, leave a sufficient amount of time for post-insertion instructions, which should be detailed to the patient before they take the denture and leave. The dentist is solely responsible to educate the patient in this regard. The dentist's responsibility does not end with delivering the denture. It is also our responsibility to educate the patient properly about the post-insertion instructions. Time spent by the dentist in this appointment, especially in the post-insertion instructions part, will actually be helpful in the success rate of the denture. The patient will come back with lesser complaints. If you have already told the patient that, see, you have to chew on both sides together, otherwise you are not going to be able to eat properly. The patient will start they will first start chewing on single side, then they will slowly shift to both sides and then get accustomed to it. Otherwise, they will come back in the next day and say, I cannot chew because it's getting loose. Next thing, if you have told them that you have to like, what do you say, you have to wear the upper first and then the lower, and they don't follow it, then they will get accustomed accordingly. Speech, if you have told them that you are going to face a difficulty with speech and this is how you correct it, otherwise the next day patient will come and say, my neighbor told me they are not able to understand anything what I'm going to say. So in such a situation, if you have already instructed them that such and such a problem is going to come and how to correct that situation, then they will utilize it. Otherwise, they are going to come back and say, see, you gave me a new denture, now I am a differently new person. People do not recognize me. People told me I am looking very different, and people told me that they can't understand what I am saying. Especially the most common problem is by the neighbors. And this is a very common complaint that most of the patients come back with. So your success of your complete denture does not really depend on how retentive your denture is. Rather, your success of your complete denture is going to be depending upon how well the patient is able to use your denture. So that depends on your post-insertion instructions. So with that, we are ending this session. Thank you.